just love the Ra Oncology department. Hello, here I am back at the Ra, waiting to get my, well, not waiting, on my way to get my PET scan results. So I hear that lovely music again. So I guess if there's news, I will be letting you know soon. Oh man, I just love the Ra Oncology department. They are so amazing. They just make you feel, I don't know, so good. It's like they really do have an extra huge measure of care and love, and I mean, I guess they know that you're going through something pretty hard. Cancer's not an easy illness. And they just show that. The admin staff, the receptionists, the nurses, the oncologists, they are all just amazing. So massive props and kudos to the Ra Oncology. You guys are such legends. So I had a pretty good appointment with Dr. Murray. For starters, he was early, which was really nice. Didn't have to hang around. Basically my PET scan results were fine. There was nothing there. Can you hear the birdies? I love them. Anyway, yeah, nothing to worry about. Again, he said to me that's not always going to be the case, but while it is, we're just going to enjoy it. We were just talking about all sorts of stuff, and I was sharing with him how, you know, these two ladies had passed away, and just sharing my, I guess you could call it survivor's guilt, and just, I don't know, how it just doesn't seem fair for these ladies. And I'm not begrudging my own easier health journey with cancer, but I was just saying it's just so unfair when they've needed surgery and chemo and all this stuff that I haven't needed. And the worst that I have in terms of cancer is basically menopause symptoms. And he actually cut me off and said, what kind of symptoms are you struggling with? And I said, hot flashes and the mass confusion and memory loss in my head. He actually said, well, we can help you with the hot flashes. I'm like, really? People keep saying to me to get HRT, and I say to them, that defeats the whole purpose. And he chuckled and he said yes. But apparently there are things that we can still try. And so he's given me a medication, and when I go back in 3 weeks, he just wants to check in and see how that medication's going. But apart from that, yeah, every 4 months he said, we'll see you again in 4 months. But then when we talked about this, he changed it to 3 weeks, just so I could check on that. But what he said, like, I said to him, I know that it's just menopause symptoms. And he said, yes, but the menopause symptoms are because we force them on you. And so with what we're doing, you're actually getting supercharged more menopause. And I was like, oh, I didn't realize that. So yay for me, having supercharged menopause. Oh, far out, good golly. It explains a bit though. And he explained some other stuff, and I don't remember it all now, but he's so willing to share and explain to help you understand. And for me, it's not that I'm freaking out about things. I just have such a curious mind. So anyway, yeah, that was my appointment. And again, God's looking after me. I just knew in my gut that there would be no issues with the PET scan. I just knew it. And I was like, God, if there is, I'll be highly shocked. But I wasn't, because I know that God's got my back and he's looking after me. And And I really actually do think that God's taken away, or not taken away, but he's killed the tumours. That's what I believe anyway. Oh, another thing, sorry, Dr. Murray did look at all my scans and stuff, because he actually was trying to look up the reports, because I told him what the GP had said about my bone spurs and about the, what's the word? Bone spurs and the collapsed vertebrae. And he looked up some reports and he goes, oh, I would question that. And then he goes, hang on, when was the accident? When were you in Modbury? And then he found the right report and he goes, oh yeah, I don't question it. Yeah, they're right. So I'm like, I was hopeful for a minute there that my GP had got it wrong, but no, she got it right. Anyway, I think all in all, a really good appointment, and I'm just thanking God yet again. Thank you, Holy Father. You're always looking after me. And I just pray that, I just pray that others who have cancer can maybe have a bit of an easier life with it, like the way I am. I did talk to him, well, he talked to me that, he said cancer has changed so much in 20 years, especially breast cancer. And like, he's been an oncologist for 30 years. And yeah, he shared a little bit about how much things have changed. And he said, 20 years ago, Linda, you wouldn't have survived this. You would probably be dead already. But it's changed so much. So I really am thankful that God gives wisdom and knowledge to people so that they can help prolong and give better quality of life to their patients. Like, wow, so thankful, especially when, you know, he's sharing how much it's changed since he's been in the business. So yeah, very interesting. And it does make me even more thankful. Yeah. Anyway, guys, thank you for listening. And this wasn't as long an update, but you know, I chat and talk, so it's probably longer than it needed to be. Sorry about that. All right, you take care, and I will see you next time. Bye.